How to protect from the coronavirus. No one is immune to this infection. Children, adults, and seniors are at equal risk of becoming infected. The coronavirus is extremely infectious, and both the strong and weak are at equal risk of acquiring it. Although there is no treatments currently available, everyone can do their part to fight the virus by protecting themselves. Most people who get the infection will suffer and then recover. However, older people with a weak immune system or pre-existing health condition can lose their life. The primary responsibility for protecting ourselves lies within our own hands. An ounce of prevention is worth a pound of cure has never been a more valid expression when it comes to this virus. Unfortunately, when someone becomes infected, the virus can be transmitted to others, including our loved ones. The only protection against coronavirus is to protect ourselves by following these guidelines. Practice social distancing, staying at least 6 feet away from each other. Frequently wash your hands with soap and water. Avoid touching your nose, mouth, and eyes. Stay at home unless providing essential services to society. Use an indoor humidifier to limit the virus from spreading in aerosol form and remaining airborne. Regularly clean surfaces that are frequently touched. Cover your mouth and nose when coughing or sneezing. Take extra precautions when grocery shopping by wearing gloves and a mask. Wipe down all packages delivered to your residence. Most people who develop symptoms describe them as fever, dry cough, aches and pains, and loss of smell and taste. If you believe you might be infected, please call your primary care provider, family physician, or your local emergency room for further advice. Thanks for watching.